Hello, this is Joe Yuhan here, again talking about advanced soft tissue mobilization strategies. And the last section we're going to talk about is distraction. So the classic soft tissue mobilization strategy is compression. That regular massage, the foam rolling, is smashing tissues together. But what if the issue, the pain, the stiffness, is actually because tissue's already stuck? Compressing that further isn't going to necessarily make them move better. And so if we go back to our tissue sandwich, we talked about the idea of muscle play, about soft tissue sliding. Now we're going to talk about the idea of distraction. And so distraction is like taking that top piece of bread off, and in doing so, can either just take one layer, that top layer, off of the other, so to speak, or just causes a traction force that moves everything. And so that's the whole idea behind cupping. So cupping is the application of that cup with a suction applied that then will suck and traction away the tissue one layer from the other. And so cupping is a great strategy. There are a lot of cupping sets that you can find online that use a small suction pump, and that's great. One of the side effects, however, is that it can easily bruise you. The suction breaking small blood vessels, and that's how you can see these big kind of circular bruises on people. If you don't want to do that, but you also want to get the traction force plus a little bit of extra mobility, the plunger is actually a surprisingly good tool. And this may seem a little bit off-putting, but this is a kitchen plunger that you can add as a dedicated tool to your soft tissue mobilization kit. And what you want to do to employ this is we need a little bit of a sort of a sticking agent. And in this case, I can just use, doesn't need to be glue or anything, but just something like an oil. And so this is coconut oil that I'm just going to put around the rim. And then the area that we want to distract, we apply the plunger. And so the area specific where the plunger is going to be useful is in the lower leg is going to be this lateral shin. And the plunger and distraction techniques tend to be most useful when we have thin layers, and especially thin layers either stacked on top of one another or against a bone. And so the lateral shin really fits that bill because you have these thin layers of fascia and muscle adjacent to the fibula bone and the tibia bone. So I'll try that here, but very often it can take a few times to get this to stick. We'll see if we can get one on this lower leg. If not, I'll show you on the thigh. And so what you'll want to do is I kind of grab, and to create my own suction, I'll sort of depress down the top of the plunger to get the air out of it, get a good pull, and then there you go. I've got my traction, my distraction force, and then I can just straight kind of pull that, or what I can do is actually slide this up and down. And so you can see I've got the traction, there's my distracting force, and I can just feel this nice pulling away. And so if I want to try to drag that down, I can. So you can see me sliding down along the shin, or I can just straight pull up until a point where the force is going to be too much and it's going to come close to coming off, but I've got a really nice pull here. So I can take that all the way down the shin until it comes off. And so it leaves a small red mark, but it's not going to bruise you. So that's a really nice strategy for the shin. IT band is another area. We'll see if we can get a pull on this one. So you can see I got a little one there, but it can be challenging to get a suction and very often requires the reapplication of oil. So in this case, I'm having a little bit of trouble here, but you saw really nice technique. Again, if we put a bunch more oil on here to reapply and get a little bit more of a seal, take the air out, And then there you have it again. So just a really nice way to pull the tissue away. So again, these advanced strategies are twofold benefit. Number one, it is a more specific layered approach. So the distraction takes that layer away, or it distracts, and then as you saw, I was able to kind of wiggle side to side. But it also is a way to mobilize tissue with much less pain, because compression is painful. This distraction technique is not. So think about this. If you tried everything and you still feel significant tissue restriction and pain, try cupping, try the plunger, try some distraction.